Well, today, Dr. Pravin Nair has joined us from Maharashtra in India, just north of Mumbai, in a city called Thane. And Dr. Nair is a consultant in senior doctor in infectious diseases. So I know you're incredibly busy just now, so it's really good of you to talk to us. How is the situation in India just now? Are you seeing a lot of sick patients?
So what we are seeing right now is that maybe we were not prepared, or we were anticipated it earlier that there would be no second wave in India because of the immunity of the Indians. So the current situation is we don't have ICU beds available. The ward beds are there because that's because of the lockdown. So I am basically based out on Mumbai. So the ground reality in Mumbai is that intensive care beds for the patients are not available currently. So they have to hunt a lot, or there's a waiting period of 24 to 48 hours or maybe more to just get an ICU bed.
But in 24 to 48 hours, presumably some patients would deteriorate and some would die.
Definitely. Not some. Most of them would deteriorate.
So the situation is that patients that could be saved are not being saved due to lack of the medical capacities, the facilities.
Yeah, I think there was failure on the part of the administration. So once the first wave was controlled, we thought that there would not be a second wave in India, and Indians have beaten the virus. And then the vaccine thing rolled out, and everybody was uh, not maintaining the social distance, not wearing the mask, thinking that now vaccine is going to do the trick. And I think that's where we went wrong, and there has been an upsurge of cases. And all those centers which were prepared to handle the first wave were dismantled somewhere in November and December, and that is how these cases now it has become unmanageable.
Right. Oh dear. Right. So what is the death rate like? Is there a lot of deaths now and in the past week or two?
Yeah, so those who are getting admitted to the intensive care, so we are seeing a lot of deaths as compared to the first wave. Ward patients having mild and moderate infections are fairly okay. They are going home, but those are getting admitted to the ICU. It's difficult.
So what is it that causes death in these COVID patients? Are most of the patients that are dying of respiratory failure?
So yes, respiratory failure is one, and we are facing a lot of patients who are coming with stroke because of the increased clotting happening. So it's a combination of respiratory failure as well as stroke and immunocompromised. A lot of patients are diabetic, so above 40, we would expect patients to be diabetic, and those
40%.
diabetic, yeah. So
So
it's a combination.
diabetes is a big risk factor.
Yeah, diabetes is definitely a big risk factor for patients who are getting COVID because we start them on steroids, and because of steroids, their sugar levels goes out of control, and then it's a cascade kind of reaction. We try to control the sugars, and then other parameters get deranged, and then finally the patient succumbs.
Right. Okay. Yeah. Of the patients that are getting infection in India, do you know
Yeah.
what proportion are becoming sick? It seems a higher proportion are becoming ill in India than it was for example, the UK or the US.
Yeah, definitely. So the proportion I would say is close to around 30 to 40%. Those who are getting COVID are now getting sick. So they
Wow.
are requiring oxygen, they are requiring intensive care, which we were not prepared for actually.
So in the UK, it was about 5% of patients being hospitalized. In India, it's 30 to 40% of patients that need
So
hospitalization.
when we see about developed countries has a protocol based system of treating. Now in India, we don't have a protocol-based system of treating. So you can get over-the-counter drugs. You can get admitted even if you have the mildest of the symptoms. So most of the time, the data which is coming out from India won't be the true picture of what actually it is.
So do you think there's more people actually getting the infections and more people dying than the official figures are showing us?
Definitely, definitely. So there is a lot of media which is adding to the knowledge of the people. So many patients are getting themselves doing a CT scan, doing a lab investigation, but not going in for a RT-PCR to confirm whether it is COVID. And by the time they come to the hospital, we have lost the crucial 9 to 10 days. And then it becomes difficult to revive the patient. So that's how the figures are always mismatched.
So after 9 to 10 days, the patients are going into the inflammatory stage of the illness.
Yes, yes.
What are the local difficulties you're having with oxygen and drugs? Have you run out of oxygen in some areas in hospital, or have you been able to maintain supply?
Yeah, so I think that's the news world over that we in India, uh, specifically in the cities, we have run out of oxygen at least once in the last 15 days, and getting the oxygen supplies is a challenge. Many patients are coming to the casualty just for oxygenation, and since don't have beds, we are giving them oxygen and sending them home. That please come back after some time to find about the availability of beds. So oxygen this time has been a major crunch for the patients.
And what about drugs? Are you able to get plenty of dexamethasone and antibiotics?
Yeah, dexamethasone and antibiotics is not a challenge, but certain drugs like remdesivir, which was propagated as a anti-COVID drug, that has run out of stock. Tocilizumab, which is used for treating the cytokine storm, that has run out of stock. So we find it difficult to procure these drugs also.
Are you routinely anticoagulating your poorly patients?
Not routinely, it depends on the test how it comes. So if your D-dimer levels are very high, then only we are going in for anticoagulating the patients.
What is driving the infection in your area? Is it the lack of social distancing? Is it the new variants? People not wearing masks? What do you think are the main things that are causing this increase in cases?
So I would say it's a combination of all the three. One is social distancing because the lockdown was removed somewhere in November, December, and then people thought that they have beaten the virus. So the social distancing norms stopped. People not wearing the mask was a common sight, and we have a the high density population in Mumbai. So if you look at it, the local trains are crowded. It was open for the public. So then the population in the local trains traveling, the buses, everything was back to normal, as if there was no second wave which is going to happen. So everything got together, and then we had to face the tsunami of patients actually.
Yes. I know you can't really tell this, but the new India variants, do you think if they escaped in the UK or the US, they would cause another wave?
So I have been reading a lot about this new Indian variant. So what has been told that it is more infectious. The transmissibility is much more higher. But I think now when it comes to UK, US, half of your population is already vaccinated, and social distancing is being followed, and then population density is again in your favor. So it won't be a major challenge even if it escapes from India to other countries.
So as far as you can see at the moment, the AstraZeneca vaccine is protecting people against severe disease, hospitalization, and death.
So we had two vaccines which were there. One is AstraZeneca Covishield, and then we had Bharat Biotech Covaxin. Both were rolled out more or less the same time. And there is a subset of people which has received Covaxin, but more of them has been inoculated with Covishield. So protection of both the vaccines somewhere comes to around 70% for Covishield and 50% for Covaxin. But we are still seeing.
Is it stopping people getting very sick? Is it protecting against hospitalization?
See, on the ground, this data might come out at a later stage, but on the ground, we are seeing patients who have been vaccinated with 2 doses are still coming in bad shape and getting admitted to the intensive care.
Oh dear. Okay. Right. Okay. Right. Now, what about testing? Are you able to test everyone that you suspect of having COVID? Is there a good PCR test capacity?
Yeah, that is one good point in the whole thing, is that testing has never stopped, and each day we have been able to scale up the number of people who could be tested. And good PCR laboratories exist, and they're all under the control of the Indian Council of Medical Research, ICMR. So that way the testing and the diagnosis is happening.
So when a patient's admitted or poorly, you're using steroids and you're using anticoagulants. Are you using any other drugs? Do you use ivermectin, for example?
Yes, we are using ivermectin very commonly, specifically for mild and moderate disease. Though current guidelines has told that there is no role of ivermectin, there is no role of Fabiflu, there is no role of doxycycline. But based on our last year's experience, we are still continuing with ivermectin and doxycycline, and we are seeing it is giving a good results, specifically in mild and moderate cases.
Do you use ivermectin and doxycycline together?
Yes, we are using ivermectin and doxycycline together in most of the cases.
And that seems to be working.
Yes, it is definitely working.
So without the ivermectin and the doxycycline, the death rate would be even higher than it is now.
So we are using it only for mild and moderate cases.
Okay.
So the only thing is that the fever effervescence is happening earlier with use of ivermectin and doxy, and none of them are progressing to severe disease.
Mm-hmm. So it's stopping the progression to severe disease.
Yes. So that way we can ensure that patients are discharged earlier.
So when you prescribe ivermectin, you always prescribe doxycycline with it. You always prescribe the two together. So you can't really differentiate which is the most efficacious of those two.
No, until unless we do some double-blind studies, which currently is not possible.
No. So
we won't come to know what is the real drug which is working. So
presumably these drugs, or the combination of these drugs, are having antiviral effects.
Definitely.
And preventing severe disease. So there are a
lot of studies which say that they don't act, and there are a lot of studies which say that they act. So ivermectin specifically, they say acts against the viral replication, and even doxy has told that it acts against the cytokine storm.
I see.
There are a lot of studies which propagate these drugs.
And presumably you give ivermectin early in the disease when it's still mild, when the patient's in the viral stage.
Yes.
What dose do you use? Is it about 14 milligrams a day, something?
No, 12 milligram for 3 consecutive days is what we prescribe for ivermectin, and doxycycline is 100 milligram twice a day for 5 to 7 days.
Okay, that's really helpful. And the key thing that's impressing me here is that you're treating these patients all day, every day, and you see these drugs working and stopping deterioration to severe disease.
Yes, definitely.
Do you advise patients to take vitamin D to help the immune system?
Yeah. So when it comes to vitamins, though the studies have told that it's not effective. There was one study specifically from Singapore where they did 2 arms. They gave vitamin D, zinc, and vitamin B6 to one arm, and they found that this arm of the patients who received this vitamins recovered faster. So we are also using that. We prescribe vitamin D, we prescribe multivitamins and zinc to the patients. And
Okay.
in any viral disease, if you look at it, zinc helps in fighting the viral disease. In fact, even for diarrhea, zinc has been used as a therapy. And vitamin D, as now everybody knows, it's a sunshine vitamin. From hormones to mental depression, everywhere vitamin D has been linked. And I personally feel that vitamin D has a major role to play in immunity boosting when it comes to COVID.
Do you take vitamin D yourself?
Yeah, definitely. I am taking vitamin D myself also.
How much do you take, doctor?
So I take 60,000 units once a month.
Oh, okay. 60. Yeah, that's fine. Yeah. Okay.
So the problem is that we do there's a lot of sunshine in India. Our work timings are such that we are unable to go out in the sun. So
Sure.
morning you leave, and by the time you reach home, it's already dark. So we
It's
have
already
to
dark,
depend on these supplements for our
indeed.
immunity.
Yeah. How many patients with COVID develop bacterial pneumonia as a complication, as a secondary bacterial infection?
So that would be close to 5 to 6%. The
That's
thing is that
quite low, right?
yeah, and that reason is that once the patients are admitted, there's a strict monitoring going on, whether it is CT scan, X-ray chest, the blood parameters are checked at a regular interval. So we find any change in that, we step up the antibiotics. So that is one reason why these patients don't land up with bacterial pneumonia. But what we are seeing is there is a lot of subset of patients who has been treated for COVID, gone home, and now coming back with infections like fungal infections.
Fungal infections, right?
Yeah, so there is a subset of patients who are highly diabetic who were started on steroids for the COVID treatment. Or they were well and they were discharged, and subsequently after 3 to 4 weeks they come to the fever clinic with fever, raised counts, and then when we investigate them, we come to know that they have developed some kind of fungal infection, specifically like aspergillus, mucormycosis.
Yes, but you have effective treatments for fungal infections.
So if it is picked up early, we have effective treatment, but if there is a delay, then usually like for mucormycosis, so we have seen 2 or 3 cases where the whole sinuses got infected, and only option was to operate and remove those fungus from those dead sinuses. And the quality of life and the patient, this is bad after the whole
So the
treatment.
fungal infections in the facial sinuses.
Yes, very
And
common.
does the fungal infection go down into the lungs?
Yes, in some cases they do. If we are not treating and picking up it at an earlier stage, they definitely go down into the lungs, even to the brain, even to the eyes.
So the fungal infection can metastasize around the body.
Yes, definitely.
Mm-hmm. Do you think many people in India will suffer from long COVID, from longer term side effects?
So those who already had comorbid conditions like diabetes and were already on steroids for rheumatoid arthritis or autoimmune diseases, they might suffer from long-term sequelae of COVID.
Right. What do you think is going to happen in India over the next month or over the next month?
So the statistics is saying that by May 15th, the peak is going to come. May 15th to 20.
So we lost the sound. Lost the sound, Pravin. We've lost the sound. Did you say May 15th will be the peak?
Yes. So statistically, it has been this predicted that May 15 to 28th, somewhere there would be a peak of COVID 19, and subsequently it would taper down. But that would go on till July and August end. But the thing is that we have to be prepared for the second wave. The problem is that we are not vaccinating at the frequency which we should be. So with a population like this, we have underestimated the number of doses required to vaccinate the whole population. And with no vaccination happening, the second wave can be prolonged for quite some time, and we might enter into the third wave within no time.
Do you think the people that are getting the infection now will help develop a level of herd immunity as a result of the natural infection?
So again, it is debatable. What we are seeing on the ground is those who have got infected, have got 2 doses of vaccine, are getting reinfected. Now we are unable to find out whether it is a new strain or new, but at the end of the day, the RT-PCR is positive. So we had a colleague of ours who were COVID positive in November, tested negative, took 2 doses of vaccine, and now again tested positive again. So these are the challenges which we face. So we don't know what is the decay of antibody levels in persons. So if the decay is happening very faster, we can have a subset of people who are vaccinated again coming back with infections.
But of course, what we hope is that there's memory cells, memory T cells, and memory B cells that give longer term immunity.
Yes, yes. That's the anticipation. But on the ground, we are seeing a lot of patients who have recovered from COVID, got vaccinated, still coming back with COVID-like symptoms, and they're testing positive for COVID. So uh, whether the immunity is short-lived or the memory T cells have not formed, again, it's debatable. We need to still have data on that.
Have you had the infection yourself, Pravin?
Not up till now.
Good. Well, let's hope it stays that way. So
Yes.
we know that you are so busy just now. So thank you so much for your time. What I'll probably do is the sound was a bit difficult, so I'll put this on as it is. But then I'll do a commentary as well to explain some of what you've said if you're happy about that. Is that?
Yeah, I'm fine with it.
Is that okay? Yeah.
Yeah.
Oh dear, it's so these pictures on the internet are just so, on the news are just so upsetting.
Yeah.
You've got tachypneic patients outside hospitals. It's just
Yes. It's basically the lack of infrastructure or the planning. So if you look at it, the healthcare system, if it had been planned properly, we could have evaded this second wave, and a lot of lives could have been saved.
Well, thank you for taking this time, and people around the world will appreciate that you've taken this time. And as an infectious diseases doctor, you're right in the middle of this, and we obviously wish you the best possible outcomes for the next difficult period of time, and it is going to be difficult for some weeks yet.
Yes.
So
Yes.
Just know that there will be thousands of people around the world thinking about you and what you're doing. So thank you very much.
Thank you so much. Thank you.
Yeah.